If you're a provider in mental health, you know the challenge we're facing. We have this incredible technology, transcranial magnetic stimulation, TMS. It offers real hope.
So much hope, especially for patients who haven't responded to anything else.
Exactly, but then we have to explain it. And the moment we go from the benefit to the mechanism, we can hit a wall.
You really can. You're talking about neuroscience, electromagnetic fields, a multi-week commitment. It's a lot.
And how we communicate all that complexity, that's often the deciding factor. It's the difference between a patient who's engaged and committed and one who just walks away feeling completely overwhelmed.
Right.
So our mission today is all about implementation. You, our listener, you already know the science of TMS, you follow the data. We want to dive into the strategies for optimizing patient education.
Moving beyond just the technical details.
Yes, focusing on supportive, clear communication, the kind that builds confidence and, maybe most importantly, helps patients stick with the full course of treatment.
It's about turning that knowledge into successful action.
And before we get started, we want to thank our sponsor. This exploration of trends in patient education is brought to you by the Blossom TMS team at www.blossomtms.com.
You know, it's interesting because that focus on the consultation itself is really where the field is advancing.
That's not just an afterthought.
Not at all. For our audience, for psychiatrists and experienced providers, we know you're up to date on the outcomes. But the research is clear. Patient education isn't secondary. It is the foundation of the treatment plan.
It's what gets them through the door every day.
It's what turns a recommendation into a real committed journey. The danger is that we, with the best intentions, throw too much jargon at them too quickly, and the patient just feels unintentionally overwhelmed.
And that overload becomes a barrier, not a tool.
Precisely. It doesn't empower them, it actually pushes them away.
Okay, let's unpack this. If the default for a provider is to, explain the mechanism of action, the neurobiology, the physics, how do we shift that? How do we get from the language of science to the language of support?
Well, the sources we've looked at are really aligned on this. You have to start with familiarity. You build on what they already know before you introduce anything complex.
So if a patient has basically zero knowledge of brain stimulation, jumping right into the cortex and magnetic induction is a mistake.
A big mistake. Because there's no anchor for it. There's no context.
So instead of leading with the physics, we connect it to things they already get, like medication or psychotherapy, just to set the stage first.
Precisely.
Right.
You establish why they're there, you acknowledge their previous treatments may have stalled, and then you differentiate the approaches. You can say, look, traditional treatments work through behavior or through biochemistry that affects the whole system.
And then TMS comes in as something different.
Right. You introduce it as a targeted, non-systemic approach.
Yeah.
It uses magnetic energy to specifically and safely activate the brain circuitry that's linked to mood. When you frame it like that, as a logical next step, the patient's cognitive load just drops.
I really like that idea of scaffolding the information. But let me push back a bit, because our audience is clinical professionals. Clarity for the patient is key, obviously, but we also live in a world of complex documentation, internal notes.
Sure.
So if we get rid of all the technical terms, are we running the risk of oversimplifying it to the point of being inaccurate? How do we balance that?
That's the tension, right. And the best strategies address that directly. The goal isn't to ditch the science. It's to build a bridge, a translational bridge. We keep the rigor on our end, in our notes, but for the patient, we use analogies and accessible language.
So we identify the trigger words, the terms that sound scary or confusing.
Yes, and we swap them for descriptions that are just as accurate, but not intimidating.
Okay, give us some examples, some concrete replacements that keep the accuracy, but, remove that clinical coldness.
Certainly. Let's take neuromodulation. It's accurate, but it sounds like something out of a sci-fi movie.
It does. It sounds a little scary.
So instead, you describe it as gently stimulating an area of the brain specifically linked to mood. It conveys the purpose and the action without the jargon.
That's a huge difference in just the perceived invasiveness. What about the setup? The motor threshold determination. That procedure is vital, but the phrase itself sounds so mechanical.
It does. So instead of motor threshold, we explain that we're determining the best custom treatment setting for your individual brain.
Yeah.
You emphasize that it's tailored to them.
I like that. Custom tailored.
It assures them that it's bespoke and it's safe without making them learn the physics of it all. That customization aspect is incredibly reassuring.
And when we describe the feeling, the experience itself, we often fall back on technical stuff like hertz or pulses per second.
And we need to immediately shift that. Move from the measurement to the sensation. So you replace pulses per second with a reference to the gentle tapping sensation that they'll feel on their scalp.
Right, because they don't care about the frequency, they care about what it feels like.
Exactly. You're setting an expectation that is physical, predictable, and mild. And if simplifying the language helps them understand it mentally, engaging the senses helps them ground the experience physically.
That's where things move from abstract to concrete.
It is. And this is where visual and sensory information become just as important as the words we use.
What's so fascinating here is how quickly those abstract ideas become real when you use visuals. The sources are so clear on this. Diagrams, images of the coil, maybe a short animation. It can totally transform the explanation.
It turns this, scary unknown machine into just a piece of equipment.
And we know what patients really want to see, right? It's the practical stuff.
It is. We should be showing them a high-quality photo of the equipment because it's often less intimidating than they imagine.
Okay.
Show them a simple diagram of where the coil sits on the head.
Not some complex anatomical drawing that looks like surgery.
No, nothing like that. Just something clear. And maybe a simple timeline showing how long a session actually lasts. We know that visual learning helps with retention, especially when a patient is feeling stressed.
That makes complete sense. They want a clear picture of what they're signing up for. But I've heard from so many providers that before patients even worry about where the coil goes, they worry about what TMS feels like.
Absolutely. And addressing that sensory experience early on is a critical intervention. It's all about preparation.
So you describe it vividly but calmly.
Yes. You tell them it's often a tapping or a pulsing, maybe a little twitch in the facial muscles nearby. And this is where the practitioner's skill really matters. You have to explicitly tell them that most people adjust really quickly.
Within the first session or two.
Often, yes.
Yeah.
And that the technician is their partner. They can make adjustments on the fly to improve comfort.
That idea of the technician as a partner is so important. It reframes it as a collaboration, not just a static procedure being done to them.
Exactly. We call it sensory pre-exposure. If they know what the machine sounds like, what the tapping will feel like, the actual experience is rarely worse than what they're prepared for. And that builds so much trust.
Okay, so moving from the immediate feeling, let's talk about maybe the biggest barrier we see, the commitment. A full course is what, 6 weeks of daily sessions?
That's a lot.
And if you just present it all at once, okay, see you every day for the next 6 weeks, it can feel completely overwhelming.
That's right. Psychologically, it's that long time horizon that creates the resistance, not really the length of one session. Which is why breaking it down into simple, digestible stages is so important.
You minimize the information dump.
And you maximize the feeling of manageability.
So we need to stage the journey. What are the key stages we should highlight to, reduce that psychological weight?
First is the setup stage. You frame that first appointment as the customization day, the mapping. You emphasize it's all about them optimizing the treatment for their unique brain.
And once that's done, it's done. The variability is gone.
Correct. Then you move to the daily routine stage, and here you shift the focus away from the total number of sessions and onto how short each daily visit is.
Right, it's just 20 or 30 minutes. Easy to fit in.
Which leads right into the lifestyle integration stage. You have to assure them they can drive, go back to work, do whatever they normally do right after. Stress the lack of downtime. That is a huge advantage.
And finally, managing their expectations about the results. That's key for keeping them motivated for the long haul.
That's the fourth stage. The progress expectation stage. You have to be clear that results usually build gradually. They might not feel a huge shift in week 1 or 2.
And that prevents them from getting discouraged and dropping out.
Exactly. You've given them 4 manageable milestones instead of 1 giant mountain to climb.
And once we've laid all that out, we have to actually invite them to talk. The sources suggest that even confident patients won't ask questions.
They don't want to interrupt the expert, or they're afraid of sounding confused.
Right. We've all seen it. You ask, do you have any questions? And they just automatically say no, even if they're completely lost.
So we have to proactively normalize interruption. Instead of that closed-ended question, you try something different. You say, look, I just threw a lot of information at you. It's totally normal to need me to repeat a few things. Where should we circle back?
Or even suggest topics. A lot of people ask about X, Y, or Z.
Yes. It changes the dynamic from them being a passive listener to an active collaborator. It gives them permission to be confused.
That's such actionable advice. But what about the emotional side? Beyond the technical stuff, they're often starting this after years of other treatments failing.
Absolutely. The clinical encounter has to be emotionally resonant, not just informative. They're feeling this mix of hope, but also, deep uncertainty, nervousness.
So you have to name that.
You have to. Just acknowledging it, saying it's completely normal to feel hopeful but also a little nervous about trying something new, that builds incredible rapport. That emotional validation is a huge predictor of adherence. Unaddressed anxiety leads to missed appointments.
So if we connect this to the big picture, the consultation needs to be reinforcing. A patient needs to leave feeling grounded, not just full of new facts.
Exactly. Which brings us to the summary. At the very end, you summarize the 3 or 4 most critical confidence-boosting points. It helps them filter out the noise.
And you back that summary up with something they can take with them.
You have to. Printed or digital materials are non-negotiable. It lets them revisit the information on their own time.
And it helps them explain it to their family. That's a huge point. They go home and their spouse asks, "So what is this thing?" And if they can't explain it,
The family's anxiety goes up, which can totally undermine the patient's commitment. A simple, accurate handout helps them become a confident advocate for their own treatment. It's about building that shared understanding.
so all of these things, the clarity, the simplicity, the emotional support, they create trust. And trust leads to better engagement. That's how we make sure the therapy actually works.
It is.
So to just review the key takeaways for our providers listening, we're simplifying the language. We're moving from motor threshold to customizing your setting. We're using visuals and describing the sensation to manage expectations.
And staging the commitment into those 4 manageable milestones.
Right. But I think more than anything, we're recognizing that the real challenge here isn't the science, it's the psychological commitment.
It is.
So what does this all really mean? If a patient's confidence and their ability to explain the treatment to their support system are so essential for them sticking with it, what's the one crucial step providers are most likely skipping when they're in a rush? And how does that one gap undermine the whole process? I think it's often that proactive emotional validation. It's normalizing their questions and their anxiety. When we skip that, the patient is left with all these unvoiced fears.
And those fears manifest later.
They manifest as missed appointments, low adherence, or just dropping out of treatment early, all because we failed to address their fear before we address the physics.
That's a powerful thought to consider as you're reviewing your own clinical process for that next consultation.
Absolutely. And as we mentioned, for clinics seeking a dependable and patient-centered device that really integrates with this kind of supportive strategy, we encourage you to explore the Blossom TMS therapy system. You can learn more at www.blossomtms.com. Thank you for joining us. We'll talk to you next time.